Hi, I'm Mason Dukacek, and today I'm with Nicole Forsberg, who is the owner of a functional medical clinic in Tulsa, Oklahoma, known as Stem Cell Therapy RX. Speaking of stem cell therapy, one of the questions that I see coming through your office quite regularly is when people are out looking for providers of stem cell therapy as an alternative to surgery or drugs and pain meds. People seem to be asking a lot about, well, where is your source of stem cells? And I've heard about people that can get it from their own body. I've heard of people getting it through umbilical cords. Can you talk to me about the different options? What are the different ways that people get stem cells and source stem cells? What way do you use, and why do you choose your method?
There's many different ways to obtain stem cell. One of the most general is autologous, which is your own stem cell. So that would be harvested via adipose tissue or through your iliac crest, which is bone marrow. And that's where the highest absorption of stem cells are
in your own body.
In your own body. That's where that source is. So they would use that. Or what I choose to use is umbilical cord stem cells. So that's healthy babies, healthy moms, and it is not invasive. I am not going into doing any liposuction. I am not harvesting stem cells from your bone marrow, which is extremely painful, and then injecting it. I am taking umbilical cord stem cells from healthy babies, healthy moms, and injecting those straight into your joint or through an IV.
And the things I've been reading on and things I've learned by being around your practice, that the stem cells that come from umbilical cords following live birth are, number one, very, very high in number.
Yes.
Like what are we talking about?
So 1 in 10,000 at newborn. We have one stem cell to every 10,000 cells, and then it just drastically decreases throughout our lifetime because we're reproducing. We're growing substantially during that time as a newborn, and then when we get into our teenage years and on to 30s, 40s, it decreases drastically down to one close to 250,000. Then on to where the majority of my patients I inject stem cells are in their 50, 60, 70 range, and those stem cells have decreased just drastically down to 1 to 500,000 to 1 to million.
I don't remember where I read it, but someone did a really good job of explaining the whole concept in simple terms. They said that when you're born, it's like having a giant piggy bank of stem cells.
Correct.
And as you get older and your body goes through injuries and whatnot, the stem cells are recruited to heal and regenerate those injuries, and you use them up as you get older.
Correct.
So what I'm just trying to do is connect the dots here, and if I am someone who's 50 or 60 or 70 years old and I've had some issues and someone says, hey, we're going to harvest stem cells from your own body, that's taking from a very, very limited supply.
Correct.
Contrast that with taking, having stem cells injected that come from the umbilical cord of a mother after live birth, which I've heard how many, millions. It's millions that you.
Millions. So one of the size that I use is 30 million stem cells, which is in a 1 ml vial.
So someone has a chance to get 30 million healthy stem cells injected into the body versus trying to pull probably a fraction, a tiny fraction of that from their own body and place it somewhere else.